Hi there. Today at TapRoots, we are talking with Katie Ainsley, the owner and certified clinical thermographer at Thermography of Brevard, LLC. Katie is married, has 5 kids, and is a breast cancer survivor. She's passionate about helping women prevent breast cancer. So welcome, Katie. We're excited to have you back at TapRoots.
Thank you.
Yeah, you're welcome. I know we've had Katie visit 2 times already, and she's coming back November 15th and 16th to offer thermography scans. I love what you're teaching, Katie, because a lot of people don't realize that thermography is pain-free, radiation-free, and non-invasive. So why don't we start by having you explain exactly what thermography is and how it's different from a mammogram?
You're completely right. Thermography is pain free, radiation free, compression free. It's completely and totally safe. Thermography is looking at the physiological changes in the breast tissue and throughout the body. It's looking for abnormalities, it's looking for the dysfunction in the body to show where there's concerns, where things are not working properly, or in the case for the breast, where there could be breast cancer cells developing and growing. And so we'll show the earliest points of new blood vessels forming, that's called angiogenesis, and inflammation and heat, which is an environment that breast cancer cells grow in. And breast cancer cells double every 90 days. So there's a lot of activity going on there that thermography can detect. Whereas a mammogram, ultrasound, or MRI, those are structural tests. So those are looking for a structure that's there. The mass has to be there for them to detect it. So it's really more of a diagnostic testing to see this is what you have, whereas thermography is the proactive screening to show this is what your risk factor is. This is what's happening, and these are the things that you can do to reverse it and prevent it.
I love that. So helpful. So, is one scan, the different types that you were just talking about, is one more accurate than the other?
So, as far as accuracy, thermography and mammograms have the same accuracy rate of about 87.5% accuracy. But when you combine thermography with a structural test, such as a mammogram, ultrasound, or MRI, it actually increases the overall accuracy to 97.3%. So it is a great adjunct screening tool to a structural test. Again, a structural test is looking for a mass that's there. Thermography is looking at the physiological changes. And right now we're just talking in referencing to breast tissue since it is Breast Cancer Awareness Month. So for breast cancer, thermography is a great first step. It's a screening tool to see what's going on, where the problem is, if there's are any concerns, what the risk factor is, and that gives you time then to reverse it and to do things. And then if additional testing is needed, such as an ultrasound or MRI or in some cases a mammogram, then that would be the next step.
Okay, great. And that's because the thermography scan, if you could, you might have already said this, but if you would just repeat how much sooner a thermography scan can pick up on abnormal changes.
Yeah, so the thermography scan is looking at the abnormality and physiological changes in the breast tissue, and it can detect those changes up to 8 to 10 years before those cells would form a mass. Oh, I'm sorry, I'm outside in Florida and we have bugs, so that was a fly.
That's okay.
Uh, but yeah, it can detect those abnormalities and those physiological changes 8 to 10 years before those cells would form a mass that a mammogram, ultrasound, or MRI could detect.
That's amazing. So tell us what different types of scans there are um, that people can choose from.
Well, we offer the breast scan, which is considered one region of the body. So, any one region of the body, the face would be one region, the neck would be one region, the breast, abdominal area. So, we offer all these different regions of the body. But if you wanted to do multiple regions, we have combos. So, we could do the breast and one other region of the body, or we have a great one that I love. It's called the Women's Health Study, and that covers the face, the neck, the breast, and abdominal area. And what that's looking for is sinus issues, periodontal issues, thyroid concerns, dysfunction, inflammation in the carotid arteries, of course, the breast, and then the abdominal area, which covers everything there from the uterus to the bladder, ovaries, liver, spleen, adrenal fatigue. So it's a very extensive one that I absolutely love. But we also have upper body, which then includes more imaging, and then the full body, which is head to toe.
Yes, I did the women's health study last time, and it's very informative, the reports you get back. We'll talk about them in a second. But first, how often should someone get one of these scans?
So when you're first starting, in order to establish a breast baseline, we recommend that you have your first scan, and then in 3 to 4 months, a follow-up breast scan. And those two combined would then create your baseline, which is why I'm coming back in November, because I was there in July, and now I need to offer the base scan for those women who had just the breast study done in July. And so that's really important to establish that baseline. After that baseline is established, it's annual scans. I have a lot of repeat customers who come back for full bodies every year because they want to see if there's any changes going on anywhere in their body, um, not just the breast, but with their thyroid, adrenals, liver, and just to check and make sure everything's on track.
Right. Okay. And so I know Katie came and saw us the first time back in the spring. She came back in July, like she mentioned. So she's coming quarterly. So you'll be able to have those follow-ups routinely with her. When someone books a scan with you, Katie, they'll be coming to TapRoots where they meet with you in a private room. You'll capture all the images, and then who writes the reports?
So all our images are sent off to board certified practicing medical doctors who have been trained in thermography. So they are considered electronic medical interpreters, EMI, and they do the imaging. I do the imaging, and then they do the reviewing and the interpretation, and they write the detailed report with any of their findings and suggestions from those findings. And then they give me the report to pass on to you. The whole process is most reports come back within a few days, and I send them out to you via email. They are password protected, so they are safe and secure. Um, but the whole process is less than a week from the time you do the imaging to the time you get your report.
Yes, it was super fast. Okay. Now, I know most insurance plans don't cover thermography, so just
Right.
tell our viewers about this new Breast Cancer Foundation reimbursement program, which is amazing.
Yes, so we're so excited that the United Breast Cancer Foundation has reopened and they have grants available. And it's a reimbursement program. So you do have to apply, but it's a simple process. You just go to the website, and I can give you the steps and procedures to do it. But you go to the website, you fill out a little bit of information about yourself, and you hit submit. And then they'll send you an email letting you know if you qualify, which almost everyone does. And then you send in a little bit more information. Again, there's no supporting documents, so it's not like you have to give them all your tax returns and bank statements and all of that. It's very simple and easy. And then they will then let you know how much they'll reimburse you for. And after you come to me and pay for the scan in full, I give you a detailed receipt that you email to them, and they will cut you a check directly mailed to you. So it's a great program. Everyone gets something back. Depending on your income, the amount might vary, but almost everyone qualifies for something.
I love it. It was easy to apply. You get a quick response, and it's so helpful. And they don't ask for all kinds of personal information like you
Right.
mentioned. So it's a wonderful program that everybody can take advantage of. So I know Katie is now booking scans for November 15th and 16th. She's already got some people on her schedule, and people she's going to be reaching out to this week that have been in contact with us. I know those dates are going to book up quickly. So if you'd like to get in touch with her to book your scan, just call or text her at 312-0363, and we'll post that for you in the comments below, along with Katie, if you would either send to us or post the link where people can look into the reimbursement program, that would be great. We love the step-by-steps for that. If you're new to TapRoots, we are Lynchburg's wellness source for high quality CBD products and offer the widest range of homeopathic remedies in the greater Lynchburg area. So you can visit us on the corner of Old Forest Road and Richardson Drive, or online at taprootsva.com. You can comment with any questions, and Katie or I will do our best to answer all of your questions. I've had 2 scans done this year by Katie so far, and I'm so glad I did. Katie's very professional. She's knowledgeable and passionate about preventing this disease. So thank you, Katie, for your time. We look forward to seeing you soon.
Thanks, Carrie. I can't wait to see you guys in November.
Sounds good. Thanks for watching. Bye, guys.